Welcome to Spectrum Perspectives, real talk with parents, professionals, and autism advocates. With your host, Cindy Gellermini.
Hi, everyone. Welcome to another episode of Spectrum Perspectives. Today, I have two guests with us. I have Ryan and Jared. Hi, guys. Welcome to the show.
Hello. Thanks for having us.
Yeah, thanks so much.
They both work for the Woods Medical Center, and it's in Pennsylvania, right over the border of New Jersey. But I'm going to tell you why I had them on the show. My friend Stacy is probably one of the very first interviews I did on the podcast. And her son Louis is in his 20s and he needed to go to the dentist. And she found out about this center down there where she could bring a special needs adult to the dentist. And she was so happy. She was so excited. She called me up right away. She was so excited about it. And she says, "You've got to come see this place and you have to tell everybody about it." So we went down and we had a tour, I'd say maybe 2 months ago. And then I invited him to come on the podcast so we could tell everybody about the Wood Center and what they do. So I'm going to start with Jared. If you could tell me what's the name of the facility, and we had, when we went to the tour, there were dentists to the right, doctors to the left, and in the separate building was the mental health, right? So tell us a little bit about it, how it got started and what they do.
So the medical center, specifically the medical center at Woods, is the official name, has been around for a while. We just opened it up to the community though. So for IDD, autism, any special disability, and they do everything from urgent care, primary care. The goal is to be someone's primary care that has, that special touch. It goes kind of across all of our outpatient services where extra time is taken. There's more of a heart. All the providers are focused on both the patient as well as the caregiver. So whether you're coming in, the intake process is a little different, where you're not sitting in the waiting room for long at all, because we know how difficult that can be for both. We do on-site X-rays, podiatry, gynecology.
That's what I was going to ask, because you have a bunch of different types of doctors, right? Like, yeah,
Yes.
Give us the list of who's in the facility.
So obviously there's PCPs, nurse practitioners, phlebotomists, or multiple probably, podiatry, I said, gynecologist, the optometrist. Did I get them all?
Neurology as well.
Neurology. So, and it's a very large facility. As you saw, there's countless rooms in there, and the services are fantastic. So it's more so an experience that once you come in once, you'll understand. The urgent care is really an important piece. The goal overall, we want to keep people from going to the emergency room because we know
right.
That's always.
I'll tell you, as a parent, the first thing that comes to my mind is that I had to take Robbie to so many different doctors that were all in different places, and they didn't communicate with each other. Okay, so he had high arches in his feet, and I knew that he was having pain in his feet when he walked, and they turned in, and I went to a podiatrist or somebody, and he wanted to do surgery on his feet. Then I went to somebody else, and he says, "Well, of course he wants to do surgery. He's a surgeon. He doesn't need surgery." And I'm like, "Could you guys just talk to each other and not put me in the middle of this? Because I'm not a doctor." So for me to see them all in the same place, and that they'll all discuss this patient, is huge, right? And also, it's really scary to take your kid to doctor because you don't know what kind of behaviors they're going to have. You don't know how they're going to act. And if the people trying to help your child don't know what to do, that's really frustrating too. Like, I remember one time when he was little, he climbed up on a slide and he fell off, and he basically fell on his head. And my husband took him to the emergency room, and they said, they were trying to talk to him and ask him questions, and he's nonverbal. And they said, "Well, how do we know what's wrong with him if he can't talk?" And I'm like, how does a pediatrician do this with a baby? What kind of a stupid question is that? But you could tell they just didn't want to deal with it. That's the problem. They don't, and I've had, when he had an infected tooth and he needed to have it pulled, the dentist flat out refused to see him. As soon as he heard he had autism, they said, we don't see special needs patients. So that's where I'm coming from. So to hear that this is, you know, this this is your focus and you want to help people like my
Yep.
son, huge. Yeah, and that's why Stacy was so excited because she had such a good experience when she went. And she said they were so good with Louis and so understanding and so patient with him, and they made him feel so welcome. It was almost like he can't wait to go back to the dentist. And what kid says that?
I remember when we met, it was the smile on her face. It was she was glowing. It
Yeah.
was, and I'm sure that
What
doesn't.
parent does that? What parent is
No,
so excited
yes.
to take their kid to the dentist?
Oh my God, I know. I hate it, but I
Mhm.
actually want to. So that's perfect segue into the. So it's Penn Dental Medicine.
Right.
Um,
And what town are you located in?
so we're in Langhorne, Pennsylvania. So
Okay.
in Bucks County, and as you mentioned earlier, we're how many minutes? We're in 10 minutes of the border with Trenton.
Yeah.
And
Yeah,
so
so we came down and it's about an hour drive, but it's a beautiful ride. It's like all through farmland and everything,
yeah,
and it's a nice ride. And for somebody like Stacy and her son Louis, she spends half of her life driving him.
I'm
And
sure.
he loves to go for drives. So that was probably the other half of the enjoyment was this beautiful ride down there and all the way back too. So, but for people that live in South Jersey, it's a lot closer for them.
Yeah.
Yeah,
No,
Yeah.
I-
So they don't have to live in Pennsylvania to come here.
they do not. From an insurance standpoint, we're still working with New Jersey to become a New Jersey Medicaid provider for both. I
Mhm,
believe Penn Dental might
I
be.
believe so.
Don't,
Yes.
don't quote us on that.
I think I was.
mhm.
I always tell families just call ahead. We'll give you all the contact information to find out if they accept your insurance.
Okay.
And if not, we do have a sliding scale fee for things for those who do not accept insurance.
Mhm.
So yeah, we're very convenient to New Jersey. We're only about 20 minutes from Philadelphia as well, so we get a lot of individuals from that area.
Right.
And
Yeah, and not all my viewers are from New Jersey either, so
right,
they could be from anywhere. But
Sure.
yeah.
Yeah. Oh, one important thing is telehealth. So I know Ryan will get into that, I'm sure, because on the behavioral side, it's that much more important. But on the medical side, there is telehealth 24/7. So it's what you would hope to have from a physician.
Right.
There's even teledentistry on the
Mhm.
dental side. So we've thought of, we think, almost everything. Um, and it's always growing and changing for the positive.
Mhm.
So everything's a learning process, but it's exciting to see it. And same with, if its first language is not English, by all means, we have resources for that. So there's really there's no barrier. Um, but it's always worth a call, and in Stacey's case, it's always worth a drive. So on the dental side, if you wanted me to touch on that,
Yes, that was my next
so
question.
yeah. So the University of Pennsylvania, um, dental medicine. That's who. So we partner with them. They basically built the clinic. They staff it. It's completely theirs. It's such a beautiful. I mean, you saw it. It is so clean, beautiful, exciting. I think we have 5 or 6 dentists on staff at any given time. And I was in there last week to get my checkup, and the equipment that they have is different. It doesn't look different than you would expect in a regular dentist office, but everything is made for special needs. So there are, whether it's the headrest flips for someone to stay in a wheelchair, or the whole chair itself, it's basically like an air hockey table where they press a button and it just kind of lifts up, and they can slide it anywhere in the room on with any weight in it. It's so cool. And then there's the chair vibrates. It's really an impressive. But again, they take their time. So when I asked when they first opened, I said, how long is an appointment in general? Because just for my knowledge, and it was, they said anywhere between 45 minutes and an hour and a half, because we just want to give everyone the chance. We don't know how it's going to go. The greatest part is when you come in, if there's ever an issue, let's say the patient is nervous, they won't get out of the car. The hygienist will come to the car. They're not going to pull anyone out of the car. They're going to show them the toothbrush. If that is the only thing that happens that day, that's a win. And they just have this, it's a partnership, an absolute partnership, where we want it to be comfortable for whoever is in the situation at that moment. And it's a really an impressive thing to watch. But they also have x-rays that they can do without the bite plates. It's, I'm not even sure what the machine is called, but it's
365 x-ray machine.
Yeah, it is awesome. And at the same time, if you're in that machine, they even showed us how, the patient wants to watch SpongeBob. They'll put it on the phone, they'll hold it up so they don't move. They're used to it. It is just, it's the exact opposite of what you were saying earlier, that the dentist wouldn't see you. We welcome anything different than your regular dentist. So it's just a beautiful thing.
What
All this-
about somebody like me? Could I come there and go to the dentist if I wanted to?
If you worked here, you could.
Okay.
No,
We're working on that, but right
Yes.
now it's
Because I'm just thinking of all the people that are just afraid to go to the dentist in general.
the medical center and the dental center are really catering to just individuals with some form of special needs.
Mhm.
We're not open to the general public as of yet.
Okay.
But Jared and I are pushing for that.
yes.
So maybe more to come down the line.
Okay. Okay.
And all of these services were born out of the same frustrations that you had, by the way. Woods has provided medical and dental care for folks here on campus for over 100 years. But we also had to rely a lot on local, either pediatricians, PCPs, or the ED when somebody had needed an x-ray for things like that. Our folks, when they go over there, they're treated, similar to the story you said earlier about Robbie. They don't know how to deal with them. They don't have the patience for it. They don't have the expertise. A lot of our folks get turned away. So we got to a point where it was like, this is ridiculous. Let's just do it ourselves. And that's when they brought in all the expertise, the neurologist, the gynecologist, the x-ray machines. So we don't even have to put our residents through that experience of having to go to an ER and sit there for 5 hours just to get an x-ray. And now the decision was made, well, we have all this thing here. Let's open it up to people out in the community, and hopefully they'll utilize it.
Anything else you want to say about? Yeah. Go ahead.
I wanted to go back to something you mentioned earlier about who works with who. And it really, I've mentioned it before, but that team aspect, it does flow across all of our outpatient. My grandmother happens to be in the hospital right now. She went in yesterday, and the report we got was, when we called the hospital, the team of doctors was in the room with her giving the report. When you hear that, it just makes you feel good.
Yeah.
That is the same here, whether it's the dental, medical, behavioral, everyone is on the same page physically because of the locations, working together, knowing, for instance, sensory wise, that this child or an adult, likes low light, whatever it is, or here's the diagnosis that we saw. It's good for you to know when you see him over it. So there's so many brains at work here that it's an amazing thing when they all work together, which you don't see unless you're in like a hospital or, that type of setting. When you go to an urgent care, they're not talking to a behavioral physician. It's very different.
Right. Yeah, and the behavioral health is a big part of it, because if your kid is acting out, they're hitting themselves, you know, they're banging their head, whatever, and the moms are trying to figure out what in the world is going on. I just answered a post the other day, and I said, I forget what he was doing, but I said he probably doesn't feel well, and he's trying to tell you, but because he can't speak, he doesn't know how to tell you that there's something physically bothering him. It's not just a behavior, you know. There's usually a reason for the behavior, right?
That-
So, you know, this way you can talk to the psychologist, the neurologist, they can check their stomach, they could do x-rays, they could do, you know, we can check all of these avenues to find out what's going on. Yeah, and you're not like I was, this ping pong ball going back and forth trying to figure out what's going on. You guys are all in the same place, which is amazing, right? So let's talk about the mental health part of it. So you have you have the Center for Behavioral Health. It's the building right next door, right? So let's shoot over to Ryan, and then one of the things that I was really impressed with is, again, something else I see on Facebook is parents that they've got the 2-year-old, they're like, I'm sure my kid has autism and I need him to get the diagnosis, but there's a 6-month to a year waiting list to get in to even get my kid evaluated. And you can't get insurance to pay for anything until you get that diagnosis, right? That's I think one of the reasons why it's important to get it, right? So so let's talk about that. Let's talk about that person that thinks their kid may have autism, and what they should be looking for, and what do they need to do.
Well, you hit the nail on the head in terms of, just, again, being able to access the service when you need to access it. So, you know, if and when a parent, or we see it a lot with teachers, they may start to inform a parent after somebody's started to interact with other people, they're seeing some of those signs and symptoms, whether it be lack of communication or isolation or stim, you know, those kind of common things that you might see from somebody diagnosed with autism. But it's then getting that parent to a place that they can figure out, what is it that's going on with my child? Is this literally just a phase of growing up and my child's going to grow out of it? Or is this something that's more significant that we really want an answer to? We've found in this, again, we're near the Philadelphia area. So in this particular area, you can't get in to get an autism assessment at CHOP or St. Chris or
Right,
any
that's
of
the
the other.
big one, is the CHOP. Yep.
Yeah, for well over 6 months to a year, and they also have limitations on ages that they'll test.
Hmm.
So one of the things we wanted to do when we opened this up was to open it to anybody, any age, and give them as quick access to those diagnostic tests as humanly possible. As of today, we have no wait list whatsoever for families to come in and get the full workup. We're also trying very hard to make sure that we have enough testers that we don't get to a place where we have a long wait list. But a lot of that will just depend on supply and demand of folks. But it's definitely one of the most important pieces, because as you said, once you get that diagnosis, that is your golden ticket then to getting services either through your school district, your insurance, et cetera, et cetera.
When they get tested, is that something covered under insurance, or they have to pay out of pocket?
No, a lot of insurance companies we're finding will pay for it. We're working now to make sure that we're enrolled in every type of insurance, including all your Medicaids across the state of Pennsylvania and hopefully New Jersey. But Bucks County is what's under the behavioral health of what's called Magellan insurance, and they do pay for the full assessment. So it can be covered by many, many insurances these days. There's also, some families, if it's not covered, they still may opt to do it out of pocket, and we also offer a sliding scale fee for that as well, because it can be a costly test.
Okay, what else do you do there? Do you do so you're a counselor, right? So do they come in, what else do they do before diagnosing, besides diagnosing the kids there?
So we're a full service mental health outpatient program. So we provide obviously your initial appointment and assessments to diagnose somebody if need be. If somebody comes in with a diagnosis already and they're just looking for therapies, we provide individual, group, and family-based therapies.
That's big.
Yeah,
Family therapy. Yeah, because
and
people always ask about the siblings. Siblings need help, need it, and the
yeah,
parents. Yeah.
psychiatric care, so you can get a full psychiatric evaluation with medicines attached to that, so you can do all of your med reviews with that person
Mm-hmm.
and continue to be seen over the long haul with them. And we provide all of those services both in person at the center and then telephonically as well.
You take Medicaid?
Yes. Again, it
So,
depends where you're from. In Pennsylvania, it's weird because
yeah,
every single county has a different type of Medicaid.
right.
So right now we're in all the surrounding counties, but if you were to call from, like Harrisburg or someplace out west, we may or may not be in that particular network, but we are beyond happy to become a member of whatever network we need to be
Right.
to serve.
Just because when Robbie was, he lived in a group home, he was on Medicaid, and I had to take him to a psychiatrist, I think, for one of his meds. Once they're over 21, a lot of them are on Medicaid, right? So, yeah.
Actually, here, majority of our kids are also on Medicaid very early. It's one of those misnomers that families don't always know, that if you have a child that has a disability, they can qualify for Medicaid at an early age. And that, even though it's considered the lowest level of insurance, it's actually one of the best levels of insurance for an individual with special needs. It covers even far more than a lot of your commercial plans. A lot of the commercial insurances have figured out ways to literally stop providing autism services.
Mm.
They'll make it provided for 7 days or one appointment, and then they call it a lifelong illness that can't be cured. So we're not going to pay anymore. Whereas
Huh.
Medicaid, you can actually access a lot more things.
Wow, interesting. That's really interesting. So let's say they get their diagnosis. What do you recommend for them afterwards? What do the parents? I always say the parents need therapy too, because they don't realize there's a high divorce rate. The parents they're very stressed out. They need some help as well for their own mental health to get through this. With no sleep and every other thing that comes along with autism world. But yeah, so what do you recommend for them? If, let's say, my kid was just diagnosed today, what do you tell them now?
So there's a number of different things that we'll recommend, and some of it depends on who's providing the assessment and what their diagnostic recommendations are. That could be, again, we usually shy away from medication management early on. We try to do other modalities long before we get there,
Mhm.
but it could be recommendations to enter into individual therapy or behaviorally based therapies. Um, it could also be, like you said, for the family members and recommendations on uh, parents entering into therapy or siblings, depending on what the situation is and the volatility. But I think one of the biggest things that we want to be able to provide families is not just that, hey, these are things you're going to need, but we try to give you the path to get there, the knowledge of what is the system. So if somebody's diagnosed with autism at, let's say, age 3 or 4, where do they go for services? So out there are early intervention services that those families can now enter into because they have the diagnosis of autism. You can go to your school district and you can work through the individual education plan, the IEP, and get related services through there, including counseling services, behavioral services, OT, PT, speech, whatever accommodations might be necessary, communication needs. So for the kids side, we want to make sure that they understand that those resources are there. Again,
Mhm.
if they're in Bucks County and they're diagnosed, one of the first things we would say is you want to make sure that you sign up for Medicaid and get that because you qualify for it, whether you as the parents have, Aetna or Blue Cross or some other insurance on top of that. You want to make sure you have that because that also opens up options for counseling, for residential placement in some cases, inpatient placements, obviously things we don't want to see, but they're now available to you because of that diagnosis. So from our end, we really want to make sure that we're providing not just the diagnosis and quote unquote, treatment recommendations, but also, hey, this is how you get from point A to point B. This is how you fill out an MA application. This is how you fill out an application to Magellan or CCBH or any of the other Medicaids to get services, to get your child on the radar for these. And then the other thing we really, really like to talk to families about is the idea of advocacy. You have to fight for services. Unfortunately, the system is not a proactive system. I wish it was. We would all love that. that they would recognize, the system would recognize that once there's a diagnosis, we need to do A, B, and C, no questions asked. Unfortunately, it's usually the opposite. You get
Mm.
the diagnosis, then you've got to go after the services. So family members, we encourage them to be advocates for their own children, but then there's also advocacy agencies out there that they can dial into and have them help not only advocate, but also navigate the system for you and let you know what resources are available in your particular neck of the woods.
It's like
And
a
then
life
from
coach. It's like they need a mom to tell them how to do
yeah,
everything. Here's how you're gonna get into college. You got to do this, this, and this. It's kind of the same kind of thing. It's like they don't know where to start.
yeah, except that it's double. You know, you're dealing, you have a child that you're raising, and you're dealing with all the factors of just raising a child in general. Now,
Right. And then you have to turn around and fight the system.
yeah, now you have the disabilities, and you've got to figure out that whole thing. So
Mhm.
it's a lot for a family to take in and to deal with. And going back to your question about, do we provide mental health services? Yes, we do. Again, we recommend it to a lot of families because it is so stressful. And maybe your experience is different, actually having a child with special needs, but I've sensed from a lot of families that they're resistant in the beginning,
Yes,
getting their own therapies.
of course.
But really, as the
Right. But
child,
come back to me in 12 years when your kid's going through puberty.
Yeah.
right, then they bigger, older, stronger, and more difficult to manage, and where you might have to hand over that care to someone else, bring somebody into your house, and then all the psychological things start to mount up. The guilt of not being able to do this all on your own,
Right.
the loss of family supports.
Yep.
I've seen so many families that the rest of the family just doesn't know what to do, so they scatter,
Yep.
and that was that person's main support system. They're
Mhm.
gone.
Hmm.
So in those ways, we therapy and group therapy in particular, which is why I think your organization is amazing, because you provide that outlet for people who are in similar boats.
That's what I was going to say. That's why I do the retreats for the moms to get together and meet each other and support each other. But the most important thing of all is they make new friends and they just meet other moms that are going through what they're going through, and they just get it. You don't have to explain,
Great.
Yeah.
Years ago, I went into a home up in New York. One of my first jobs at Woods here was to do clinical evaluations for kids that were being recommended for a residential placement here at Woods. And I went into this home, and the walls were gone. They
Mm.
were the studs.
Hmm.
There was a TV on the floor and
Hmm.
a table with 2 chairs. That's it.
Hmm.
And I'm sitting there with the mother and kind of waiting to see, okay, where's the young man I'm supposed to meet today? But you can see that she's incredibly nervous. I mean, she's looking around almost like she's waiting for something to happen.
Hmm.
And all of a sudden, you hear the shower turn off. And out of the corner of my eye, I see 16-year-old kid, big kid, very stocky, well built, coming right at me,
Hmm.
running as hard as he can, soaking wet.
Hmm.
Before I could blink, the mom got between he and I with like that. And you walk out of there and you think, that's what her world is right
Yep.
now. And does she even know that she's been consumed by this for 16 years?
Hmm.
And
Yeah. The
we want,
PTSD.
yeah,
Yeah.
we want to
Hmm.
open up. Like, there's people out there who can help you. There's support so that you don't feel so isolated and trapped. It was just one of those days that really rocked me and
Yeah.
emotional in terms of
Right.
what people go through and
Right.
what then they consider to be just a normal day.
Right. My son, my other son, he teaches special ed, and during COVID, he had to do virtual learning. And one of his students, um, big boy, like you're describing, didn't want to do the work, and he literally beat the crap out of his mother in front of my son watching like this. And my son was horrified. There was nothing he could do about it. And this mom hides in the bathroom behind a locked door down in the basement from him. So one of the things that I do at the retreat is I bring somebody in to teach self-defense, but I told them, I said, but you have to do it in a way that they don't hurt their opponent because it's their child.
Mhm.
So they teach them how to get out of if they grab you this way, or if they grab you this way, like just how to get out of the hold, that type
Yeah.
of thing. Um, but it's like you're saying, that was sort of like a life-changing moment
Yes,
for
I
him, and people don't realize that that is how some people live, you know? It's like this war zone in their house, and they don't know who to go to for help, and they just feel like this is just my life, and, you know, there's nothing they can do about it.
did you happen to notice when you walked through any of the buildings that you toured here, the medical center, outpatient center, big blue
The blue
pads?
mat, yes.
Yeah.
Yes, 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 talk about that. Mhm,
So Woods adopted a philosophy. It's called UCARO. It was actually developed by a school out in Virginia called Grafton. And the whole idea is that you, instead of going hands-on with somebody who's having, significant behaviors, the idea is to try to comfort them and to try to give that individual the feeling of as much control as possible.
mhm,
If somebody becomes aggressive towards themselves or others, one of the first thing all of our staff are trained is to back off, get
mhm,
out of place, give them time and space.
right,
Um, but if they were to continue to hit their head really hard in a violent manner or come at a staff person, we would then use the mats to mitigate the damage. So if that child is coming towards me and I have the mat, I'm just receiving. I am not pushing back. I am just basically taking it. If they're hitting their head, you could place the mat between their hand and their head, just to try to absorb. But everybody in all the centers are trained in this methodology to try again just to calm the person down, let them
mhm,
have their moment, and hopefully diffuse the situation without, like you're talking about, escalating it to the point that somebody's going to get hurt or the client's going to get hurt. So
right.
that's why all those pads are strategically positioned around all of the buildings in the off chance that somebody does have those moments. But again, the pads show you that we're used to it.
So you're
It's
saying
not,
this method doesn't use restraints?
no, no,
Mhm,
we will not use hands-on restraints unless we get to a point where the Eucaro pads and every other possible intervention has failed. And you don't really see that too much in those centers. You see that more maybe in a school program or someplace where there's task demands on that person.
mhm,
Uh, but yeah, it's definitely a very, very useful technique, and our staff have really embraced it.
and how long have you been using that? It's
We
been
have been using that. That started well before COVID, so I would guess about 5, 6 years now.
mhm.
I've been using that, and our need to put hands on our individuals here dropped down to almost zero.
Mhm. Good. Good. Okay, good. Good to know. Are there specific treatment modalities?
You had mentioned when we were talking earlier about the idea that when you get that recommendation, that nine
Mhm.
times out it's going to be for ABA.
Yes.
Where basically what I'm saying is that no, there's all these different options out there, and you shouldn't be pigeonholed into going to one modality based on just a diagnosis. There's lots of different modalities, and it really depends on the individual, what their specific needs are, and what works. So
But there are other, there's other options. I think, what is it, play therapy or something else? Like I've just seen people asking questions online, like what their other options are.
yeah, yeah, there's lots of different modalities that are out there that have now shown some research behind them. I mean, you can do. We don't do true ABA here at all, but we can do some behavioral modification that's similar to it.
Mhm.
It's not real. It's not real strict, but
Mhm.
it depends on the person. Play therapy is one. Equine therapy is something we utilize here. We have a huge zoo area and barn
Mhm.
area that even it's right next to the medical center and the outpatient center,
Right.
so families can go over and participate in that. There's pivot therapy. There's a whole host of different therapies out there that have
Mhm.
shown to be effective for individuals with autism.
Do you
So
ever work with the school districts?
we will if the district wants us to.
Mhm.
A lot of times school districts they have their own, internal group that does the program for the school, but we've met with a ton of school districts in the area in order to let them know that we're here, that we're happy to provide the diagnostic side of it, the counseling side of things, the med management side of things, if they'd like.
The
Yeah.
reception.
Just because a lot of parents, I feel, they fear the IEP meeting.
Yeah.
And, you know,
Right.
they're not, I don't know why, I guess they think they're not going to get what they're asking for, but do you help them with some guidance of like maybe what they should be asking for? Or?
I absolutely do. That's going back to the very beginning. If you have recommendations that we'll make, I am not physically located in the outpatient center every day, but if a parent or someone comes in and needs information, they will provide them with my name or one of my team members' names, and we will be happy to help them through that. I've worked with many, many families on kind of preparing for the IEP,
Mhm.
and knowing again what services they would like to have in place. And then, like I said earlier, it's advocacy. It's fighting for what you want,
Right.
and not backing down to the district. And those my both of my sons had IEPs,
Mhm.
and the meetings are intimidating. I mean, very intimidating. You have a whole room of people
Right.
telling you what they're seeing, and you're sitting there.
Mhm.
It's you versus. So,
All these people that are supposed to be the experts. Yeah.
yeah,
Mhm.
correct.
Mhm.
So, a
I
lot
was
of it,
very naive. I just went with the flow. I'm like, whatever, you guys are the experts. You tell me what you think I should do, okay. I was very, very easygoing. I didn't know I should be fighting for anything different. So, but things are very different now.
yeah. Well, now you have so many online places that you can gather information as well, which I
Yeah,
think
there
is
was no
good.
internet back then.
No, but
It can be a blessing or a curse, Yeah, because right away people Google and they see all these horror stories and then they get scared and
Yep.
yeah.
yeah, having that knowledge of what is out there, what things would work for my child, and then
Hmm.
being able to ask for them in the right way and advocate for it
Hmm.
is one of the pieces that we see is missed by so many families for a variety of reasons.
Hmm.
So it's definitely one of the things that we want to make sure families, when they're working with us, they know we will be here if you want those types of supports.
That's very comforting to know, that there's somebody out there that can help people navigate through this, just right from the very beginning. What if even somebody's got, they got a 14-year-old and they're like, I need help. I don't know, because things are changing. They're not little anymore now, there's different, whatever, different behaviors or whatever that can develop. Plus also they're starting to say, okay, my kid's going to graduate school in a few years. What's next? You know?
The Again, that comes back down to knowledge and advocacy, because again, my biggest knowledge points are in Pennsylvania and New Jersey, and the entire system changes when an individual turns 21.
Hmm.
The way that somebody is funded completely changes, and the actual level of services that are out there and available changes dramatically.
Hmm.
So again, we really, if we're working with somebody here and they're turning 21, we're trying to again educate them on what those services are that they could tap into and how to tap into them. But it's definitely a major hurdle for families, and it's a huge stressor. We see a lot of families that their loved ones have been in a residential program or some other level of care, and that 21, they're like, we're done. There's no
Yep.
place for those.
I remember Robbie went to school till he was 21, and I remember the day of my last parent teacher conference at school. And you sit out in the hall at a desk waiting for your turn. And I was out there for almost an hour waiting. And finally, the other mother came out, and the teachers, she apologized to me. She said, "I'm so sorry," but she was crying the whole time because she doesn't know what's going to happen to her son now after graduation, after 21, and they didn't know how to help her. They didn't know what to say, and they just let her cry, and they didn't want to make her stop. So I had to wait. So so that's how
Wow.
parents feel when their kids are turning 21. They're like, where do we go now? And there are day programs out there, but if they have a behavior, if they have seizures, they won't take them.
Yep.
Yeah, over 21 is a mess.
Yeah, it really is. And
Mhm.
we again, with a lot of the kids that we work with, the families aren't bringing them in until they're 16, 17, 18 years old.
Right,
So you're right on the edge of that 21, and
right,
it's eye
right.
opening.
I mean, and I keep pushing parents too because they don't you know, they don't understand the whole guardianship and SSI, and you know, they don't get them registered with DDD or anything. I'm like, what are you waiting for? Like, get
Right.
on the ball. But I don't know if it's denial or they just don't know.
Right.
But yeah, they need help. They need help. So, all right. So you don't just do like therapy like in the center. You actually are like helping people navigate this
Yeah.
whole
Yeah. It's one of
whole
the
system.
main things we want to do is to help people.
Wow.
Whether it, when, you know, there's cases too where we don't provide a particular service that would be in the best interest of that person. So
Right.
we'll do our best to hook them up with somebody that we know who does.
Right.
It's obviously their choice if they want to use that provider, but
Right.
we've done a lot of work, Jared and the team, of affiliating with other members out in the community. For example, we don't provide in-home TSS supports for kids on the spectrum.
Which is what? What is that?
That can be typically it's mobile therapy. It can be a team of people.
Like,
Usually,
what
it
does
would be
TSS mean?
therapeutic support staff. They
Okay.
might call it something different in
All
Jersey.
you medical people throw all these terms out,
Come on,
all these letters.
but it's basically a team comes into your house. They do a home assessment. They assess the child. And they say, you know, he could really benefit from in-home counseling once a week or parent training once a week.
Right.
And then we're going to send a staff member in to work with your child from three o'clock in the afternoon till 7 o'clock at night.
Yeah,
Uh,
parent training is huge.
yeah, and we're not one of those providers yet.
Right.
So we've partnered with a bunch that are
But you know
around.
someone who can do it.
Yeah,
Got it.
right.
Got it.
So, you know,
Random question is, I know of some kids that are, they're not autism special needs, but they're ADHD. And the parents need some training on how to deal with them. I've talked to ABA people and they said, no, they have to have an autism diagnosis. We don't work with that. So what do you do with a kid like that?
so yeah, we wouldn't be looking at ABA or any of those types of therapeutic modalities because they're not useful for an individual with ADHD.
Right. But the
But again,
parents need to know whatever, setting the boundaries, like they have trouble transitioning, right? Every time it's time for a bath or time to go to bed or whatever, complete meltdowns,
yep.
you know. You know, I'm concerned about that, those kind of families too. It's like, I don't know how to help you. You know, I know that there's people out there that can help you. I just don't know who.
Yeah, the center, we have a lot of different therapists there, and a lot of them will have expertise in one area or another. So we would try to hook them up with a clinician that's well versed in ADHD, along with either a psychiatric nurse practitioner or a psychiatrist that's versed in that area.
Hmm.
And they would meet with them, can provide counseling to the individual, counseling to the family, parent education, craft a plan for, you know, these are the interventions we want to work on in the home.
Hmm.
Collaborate with the school if they're willing to do it for interventions in the school program.
Yeah.
So
Yeah. I just feel like we're getting to the point now in our society where every kid has something, every kid in school,
oh
whether
yeah,
it's food allergies, diabetic, autism, ADHD, whatever, you know what I mean? Dyslexia, whatever. It's like, I feel like every kid almost is going to have an IEP or a 504 plan or something, you know, and teachers need to be trained now in how to handle all these different situations. You know, this is just, it's becoming the norm.
Yeah, it
So,
also it depends on the school district of, you know,
mhm,
from inner city Philadelphia compared to down the street here in Neshaminy. There's
mhm,
the amount of people on the staff from one to the other. It's, I mean, I can't even explain these meetings that we're in where it's one person and she has a child in the room with her while having the conversation with us, where we're telling them about our services, and the kid is, she's trying to shush him,
Mhm.
and he's special needs, and we're like, if you need to go, that's okay, you know, and
mhm,
send you there for, and she's like, no, this is my normal day.
mhm,
And compared to a huge team of people at a more suburban
right,
school, they both public schools, and
Mhm.
it's just shocking that you can tell the care is there, but the focus, they can't just focus on, the one person has to focus on all the kids compared
Mhm.
to, maybe there's a few even per grade. And
Right.
it's just, it's unfortunate and it's
Right.
sad.
Right.
There was something else that, there's so many services that we provide that, I know from like my son, for instance, he was tested for ADHD, and we're like, he definitely has it. But for whatever reason, the testing didn't come through that way. But, once we got through the discussion, it was executive coaching it's just another avenue. So there are certain things that, the that we can provide that where you're not just left alone and to
Right.
say, throw up your hands and say, I guess I got to deal with this forever.
That's exactly my point. That's what I feel a lot of parents just feel like. They're like, you know?
Yep. It's scary. And
Mhm.
yeah, you need that team. That's what we talked about in the beginning.
Mhm.
You need the team people that actually care.
Right.
And
Right.
I mean, I am on this side. So I know I can say that we have this, but I know it.
Mhm.
So
Right.
um, but it's pretty exceptional to watch.
Mhm.
Um, and because they're always talking to each other just about
Right.
everything. So
Right.
it's important.
Yeah. Yeah. If people want to get in touch with you, what do they do? What's the contact info, the phone number, and who do they specifically reach out to?
So they call 215-750-4004.
Yep. Okay.
And then that is for Woods Healthcare, which is the umbrella to all three.
Okay.
And it'll say on there which facility would you like to speak
Okay.
to?
So they might want to go to the doctor or to the dentist, but what if they want to talk to Ryan?
So they
After
would
they
go,
watch this video, they'll be like, I need to talk to this guy.
so they would opt for the Center for Behavioral Health and
Okay.
then just simply ask for me.
Okay. Okay. Are you the only Ryan there?
Not the only Ryan, but the only one associated with the outpatient program.
Okay. Got it. All right. Terrific. Thank you guys for being with us today. And I think what you're doing is greatly needed and very much appreciated as a mom. So thanks for being with me today.
Thank
Thanks
you.
for having us.
Thanks so much for having us.
That's it for today's episode. I hope you enjoyed listening and it helped you gain a new perspective. If you're interested in buying our book series, Robbie's World and His Spectrum of Adventures, the link will be in our episode description as well as my Instagram and Facebook pages. If you enjoyed the show and you'd like more content, please be sure to hit that like button, follow us, and don't forget to leave us a great review. Thank you for joining us. Be sure to join us again on our next episode of Spectrum Perspectives.
Thank you for joining us today. Be sure to join us again on our next episode of Spectrum Perspectives.